Myself, Dr. Yogeesh. I'm a consultant neurologist at Manipal Hospital Yeshwantpur. Today, I'm going to speak about GBS, also known as Guillain-Barré Syndrome. So, Guillain-Barré Syndrome is an immune-mediated neurological illness which affects the peripheral nervous system. Peripheral nervous system means the extension from spinal cord till the terminal nerves. So, we are going to speak about how it causes. Next thing is, what are the triggers of Guillain-Barré Syndrome? So, those who develop Guillain-Barré Syndrome usually have an infectious trigger 2 to 3 weeks preceding the illness in the form of either a small respiratory viral infection or a gastrointestinal infection that lead on to development of antibodies. These antibodies attack the nerve cells and this causes the Guillain-Barré Syndrome. So, how does it act? So, these antibody affect the peripheral nerves. Or peripheral nerves are like wires that conduct the electricity. So, they will have a conducting material inside. Surrounding that there will be insulating material. So that insulating material is similar to that insulating material we have myelin sheath in and around the nerves. So when this antibody attacks this myelin sheath, there will be failure in the conduction of signals from the brain to the peripheral nerves that results in Guillain-Barré syndrome. So what are the symptoms? The most common symptom that the patient presents are like weakness and paresthesias. Weakness is also known as paralysis. Usually the patient develops the weakness in one part of the body, usually in the lower part of the body, which slowly ascends up to involve lower limbs and then upper limbs. In rare cases or if severe diseases, it can also involve the respiratory muscles, leading on to respiratory failure and other complications. So, how do we diagnose this Guillain-Barré syndrome? So, most important thing in diagnosis is to take the proper clinical history and clinical examination. As I already mentioned, most of the patient presents to us with complaints of the weakness of the limbs and associated with paresthesia, means tingling, numbness and other sensory symptoms of the nerves. And if they progressively involve the lower limbs and then upper limbs, there are some variants of the Guillain-Barré syndrome where they can simply involve only facial muscles or they can only involve the lower limbs, and in some variants they can still only have imbalance while walking. So once we confirm the history from the patient, then we move on to the other diagnostic modalities. The most important diagnostic modality in diagnosing Guillain-Barré syndrome is nerve conduction studies. Nerve conduction studies means we stimulate our peripheral nerves with a small amount of current and we record the signal from the distal end. So how the nerves are conducting. So based on these test reports, we diagnose the Guillain-Barré syndrome. In some of the patients, to confirm the diagnosis, we also perform lumbar puncture, which involves tapping a small amount of the fluid around the brain from the back, and we examine those, and after examining those we will find certain findings such as elevated proteins, and this helps in diagnosing the Guillain-Barré syndrome. It not only helps in the diagnosing but also helps in ruling out other mimics of the Guillain-Barré syndrome. So once we confirm the diagnosis, then we move on to the treatment. So treatment includes two aspects. One is acute management of the Guillain-Barré syndrome. Second thing is chronic management. First thing, whenever the patient is diagnosed with Guillain-Barré syndrome, we have to assess how much is the weakness, whether there is any involvement of the respiratory muscles leading on to respiratory failure or not. If the respiratory failure is if the respiration is involved in this syndrome, then the supportive care becomes priority, where we have to intubate the patient and manage with the ventilator. Along with that, we have to start the management for the management for the Guillain-Barré syndrome per se, which includes IV immunoglobulins or plasmapheresis. IV immunoglobulins means this is a pooled immunoglobulins from the healthy individuals, wherein they collect the immunoglobulins from all the healthy individuals and pool it, and these are given to the deceased person, which acts as a immune checkpoint, and this prevents the further damage to the nerves, thereby helps in recovery of the damaged nerves. Another option is plasmapheresis. Plasmapheresis includes it involves the removal of the small amount of the blood from the body continuously and removing the antibodies which are causing damage to the nerves and resulting in recovery. So usually this plasmapheresis includes 5 depending upon the patient's severity, we usually do 5 sessions over 10 days. And in immunoglobulins, we give 2 gram per kg body weight, which is also over 5 days. So after this acute treatment, then comes the rehabilitation part. Once we give these immunoglobulins, most of the patient will stop the progression. Later, for the further recovery, they require neurorehabilitation in the form of aggressive physiotherapy and other management. Thank you.